Hello friends, welcome to Forensic Medicine by Dr. Paras, and now we are going to talk about chapter number 3, that is Medical Jurisprudence. Medical Jurisprudence deals with the legal responsibility of a doctor. As a doctor, what is our legal responsibilities towards the society, towards the treatment of a patient and a healthy environment in our hospital, my dear friends. So first, let's talk about the National Medical Commission. So what is the function of National Medical Commission, my dear friends? First thing is medical education. Dealing with all the medical colleges in the country, their education, their level of education, their level of curriculum, they will be dealing with that. That is medical education. Maintaining the registration of a doctor. Whoever doctors, they are graduating, their register need to be maintained with the National Medical Council, my dear friends. So these are the two important facts right here need to understand. Providing medical education. After medical education, first we'll provide the medical education, then after medical education, conducting of exam, then after conducting an exam, we'll be registering them as a registered medical practitioner. That is called as RMP, my dear friends. Now, also FMGE examination, to conduct the FMGE examination also is coming under NMC only. Now, my dear friends, there are the two schedules we need to focus right here. Schedule 1 and Schedule 2. Schedule 1 is for Indian medical graduate and Schedule 2 is for the foreign medical graduate, my dear friends. So, two schedules are there basically. Schedule 1 is for the Indian medical and Schedule 2 is for the people who are studying abroad. They are the foreign medical graduate. Indian people who are going abroad for their medical education, and after coming from abroad, they have to go under examination, which is now conducted by NB, National Board of Examination, that is Foreign Medical Graduation Exam, FMGE exam. Now, let's talk about this topic called as medical ethics versus the etiquettes. If we talk about the medical ethics, my dear friends, moral principles of doctors towards everyone. Everyone. What do you mean by everyone? Who are coming under everyone, my dear friends? Everyone means towards their colleagues, towards their patient, towards the place where they are working, and they are decided by the National Medical Council. And if they will not obey these, and this is highly punishable, my dear friends, if we not treating our patients properly, not talking to our patient properly, not giving the appropriate treatment, then will be punishable, my dear friends, for the violation of the medical ethics. Now coming next, medical etiquettes. Professional courtesy amongst the doctors. Among the two doctors, there is a professional courtesy. For example, me and you both are doctor. You are coming to me for the consultation of you or your family member, and I am charging my consultation fees from you. Ideally, I should not. Medical etiquette teaches us that we should not charge any kind of fees. But I am charging. That is not punishable, but yes, that is violation, or you can say that is an insult to the medical etiquettes. As a professionals, we should not do this, my dear friends. So this is basic difference between the ethics, that is moral principle of doctors towards everyone, and medical etiquettes, which is a courtesy amongst the doctors. Now, what do you mean by infamous conduct, my dear friends? If we have to talk about the infamous conduct, my dear friends, that is professional misconduct by a doctor. Professional means on duty. On duty while treating the patient, we are under influence of alcohol and then treating the patient, and the patient died, or there might be some kind of serious consequences. That is not at all required, my dear friends. Alcoholism, adultery. You have asked your patient to lie down for an injection or some PV examination, and you are doing some kind of videography there, or you are just taking the benefit right there. Those all are coming under adultery, and these all are the infamous conduct, my dear friends. Then advertisement, for example, fake degree. You are not cardiologist, but still you are writing with your name cardiologist, you are the best cardiologist, etc., etc., and people are coming to you for the treatment, and that is completely infamous conduct, my dear friends. Active euthanasia. Active euthanasia, guys, remember This is also not valid in India these days. Passive is yes valid, but active is not valid. Euthanasia means giving a death to a person who wants it. Person who want to die on his own because person might be suffering from a disease which is non-curable, and we are putting that person onto the ventilator. And on ventilator, if we remove the ventilator support, that will be passive euthanasia. And if we are deliberately putting some kind of hand and making that person die, this is active euthanasia. Active euthanasia is not valid now. This is infamous conduct. But passive euthanasia, yes, it is allowed. We'll be talking about that very soon. Now, accepting gift from patient, is it allowed or not allowed? Not at all allowed, my dear friends. You can't accept the gifts. You are treating a patient and a patient is coming to you again and again. Doctor Saab, please have this. Or Doctor Saab is asking patient, oh my God, I have treated you. I need some kind of gifts from you. Maybe you are a diamond merchant. Give me some diamond ring. You cannot. Or you might be running some kind of a travel company and you cannot ask them to give you gifts, my dear friends. So accepting gift is also not allowed. This is infamous conduct. Then bribe, obviously you cannot take any kind of money. If you're government doctor and for the early treatment of a person, you are taking some kind of money, or for any kind of unprofessional work, you are getting some money to do it under table, then those things are also not allowed. Covering, taking non-medicos help in medical procedures. Yes. So in India, many places you might have heard about these things, that a senior doctor has trained some non-medical staff. Why they are training the non-medical staff? They are cheap laborers. To be honest, if I have to explain it, I would love to say that they are the cheap laborers, and eventually they become skilled, but that is not allowed. According to the medical dictionary, if we talk about the medical ethics, this is completely a violation, my dear friends. We are not. Criminal abortion. Criminal abortion is an abortion which is without consent of mother. If there is a no consent of mother, then that abortion is considered as criminal abortion. Disclosing the confidential patient information. For example, rape. A rape victim is coming to do, my dear friends. Okay? A rape victim is coming to you, and you are not supposed to tell the name of the rape victim to anyone. And you are telling name to the media people, and media people are spreading name everywhere. That will make that person's survival in the society very tough. So that is not allowed. That is completely a violation. Then one more thing I want to add right here, sir, that is dichotomy. Dichotomy is fee splitting for investigation and treatment. For example, you are a doctor, you have ordered investigation and you are sending that person to the particular lab for the diagnosis, for the investigation, and from that lab you are getting the money. That is also not allowed. That is infamous conduct, my dear friends. Religious discrimination is also not being, if you are a Hindu doctor, you cannot discriminate other people who are coming to you for the diagnosis and the treatment. You cannot do that, because doctor itself is considered as God, my dear friends. If God started discriminating, then to whom the patients will go? So we should not. False certificate, any kind of false medical, any kind of false bed rest, that is also not allowed in such cases. So all the points I just want to repeat because they are very important for everything, for every stage of your life. First is alcoholism, then coming to the adultery, then advertisement of fake degree, my dear friends, active euthanasia, then accepting the gift from the patient, bribe, then covering, that taking non-medicals help for the medical procedure, then criminal abortion, my dear friends, disclosing confidential patient information, religious discriminations, false certificate, dichotomy, and also one more thing I want to add right here, sir, that is endorsing a brand. You cannot, a particular company's product, you cannot endorse them. As a doctor, you should practice ethically, okay? So what is a punishment or for infamous conduct? That is very, very important. If infamous conduct has happened, there must be a complaint. Complaint filed in a state medical council against the doctor for infamous conduct. If someone found you doing fraud, any kind of fraud, whatever we have discussed so far, the complaint must be first filed to the state medical council. State medical council will form a committee of doctors to investigate the facts. There will be a committee of 2, 3, 4 doctors who will be investigating that whether the claim or whatever the allegations were there on the doctor, are they true or not? They might send a team of doctors to the site. They might check with the patient, other patients also. There are the different criteria to check that. If the doctors involved in the infamous conduct, if the team has found doctors involved in the infamous conduct, then the state medical council will give the punishment. Now, what type of punishment the state medical council can give, my dear friends? One is a simple warning. If the infamous conduct is minor, very minimal conduct is there, only warning is given. We'll give that warning to the doctor and we'll say you should not repeat these things further. Then if the infamous conduct is very severe, which might have taken someone's life, then penal erasure would be there. What do you mean by penal erasure? Sir, cutting off name of doctor from state medical council. If your name is not there in the state medical council, are you allowed to practice or not? No. Think you become doctor. You spend it 5 years in completing the MBBS. Now you are practicing. 6 to 7 years of career is spoiled just because of the infamous conduct. So we should not be involved in any of these things. Clean, crystal clear practice can only lead or can only make you a very good doctors, a reputed doctors. Then temporary, there can be a punishment up to only 2 to 3 months, 4 months, 5 months or 6 month penal erasure is there, 1 year penal erasure is there. Permanent penal erasure is also called as professional death sentence. Permanent penal erasure is also called as professional death sentence, my dear friends. Now, professional death sentence, if we have to study about the professional death sentence, my dear friends, permanent penal erasure also called as professional death sentence. Who will confirm this? National Medical Council. Who can give this? Who can give this? State Medical Council. Who can give this? State Medical Council. If doctor is not convinced, if doctors say that allegation, whatever they have put it on me, I'm not satisfied with all the proceeding which has done in the State Medical Council, that doctor can further appeal in the NMC. First, State Medical Council, see, State Medical Council. Then it is confirmed by National Medical Council. After National Medical Council also, he can appeal in the Health Ministry. Health Ministry. So this is what you need to learn right here, sir. So doctor not convinced from the NMCs also, then he can go to the Health Ministry, my dear friends. Second topic what we have to start here, sir, is professional secrecy. Now the patient personal information must be kept confidential. Disease which the person don't want anyone to know, come to know, you should keep that private. Whatever information your patient is providing you, by trusting you, you should keep that confidential. Name, information, sign and symptom, except some diseases which are communicable diseases. In that scenario, you can inform the concerned authorities. But otherwise, in all of them, information, the sign and symptom, the information, every 360-degree information, you need to keep the confidential. That should be only between you and your patient, my dear friends. Now, what are the exceptions? As I just talked about the exceptions to the professional secrecy, my dear friends. First is in the interest of community. As I told you, notifiable disease, for example, corona, TB, cholera. Notifiable disease which can spread from one person to another person, those kind of diseases, you can tell others also. Crime must be intimated to the police under 39 CRPC. For example, you are a doctor and someone came to you after fighting with someone and someone murdered someone and he's coming to you for the treatment, etc. And you are not informing to the police. This is also a crime. So my dear friends, crime must be intimated to the police. In crime, you have to inform the name, detail of the patient, whatever has happened. Infectious disease also. For the interest of the community, if there is any kind of infectious disease, that also we have to intimate. Vernal diseases, for example, HIV, hepatitis, who can take your life. These type of diseases, for the interest of community, we have to inform to the concerned authorities, my dear friends. In this, professional secrecy is done. Now, in the interest of patient, like the patient is getting suicidal thought, whether we should inform the parents or not. Yes, we should, otherwise the person will die because of the depression. So if the person is coming to you and telling you, Doctor Sahab, I'm feeling like dying, etc., then in the interest of a patient's safety only, you can inform those things to the parents, my dear friends. Then coming to in the interest of court of law, medical negligence is there. In the interest of court of law want to know whether the medical negligence was there. Medical negligence is a thing. Doctor has, like example I'm giving you, doctor has given a medicine which was expired. This is medical negligence. Doctor was operating someone and the gauge piece, etc., left inside only. So these all things are called as medical negligence. Then for the sake of medical examination also, you can provide the patient information. You cannot deny court that you will not provide the information. In all those scenarios, yes, you have to provide the information to the court, my dear friends. Now, consent in the medical practice. If we have to talk about the consent, what is consent, my dear friends? Consent is an agreement, permission or compliance. So what is consent? Consent is agreement, permission or compliance given by Indian Evidence Act 13. Okay? Now, type expressed consent given orally or in written. Express. For example, intern doctor has to put RT, Riles tube. Now, first thing is you will inform the patient, attendant, that I am putting RT. It is very important to put the RT, but there might be a chances of bleeding. Chances of bleeding. But it is necessary to put. Are you giving me permission or not? The attendant will say, yes, Doctor Sahib, I am giving you permission. Second thing, you will take everything in written. Whatever they are saying, everything you have to take in written from them. Yes, for example, yes, I give permission. Respecting all the facts, all the outcomes, I am giving this permission to my doctor to put the Riles tube and sign. This is express consent given orally or in written. Now coming to the second type of consent, that is called as implied consent. Implied consent, a female going to a male gynecologist. This consent is also, you can say, given as a mean of gesture. For example, I am a male gynecologist and a female is coming to me for the per vaginal examination, and I have asked that female to just lie down on her bed by removing the piece of cloth. That is obvious that if I am going to a male gynecologist, I have to do that. And that type of consent is called as what, sir? Your implied consent. For example, a female patient going to a male gynecologist chamber implies that the consent to the pelvic examination by the male gynecologist. This is obvious that it will happen. And I am going with my own will. That is what? Means of gesture. Third type of consent, if we talk about, sir, informed consent is a best consent. Informed consent is the best consent. Written form of informed consent is the best form of consent. Inform, written form. Inform. First you will inform, then you will take in written. Patient is briefly informed about the outcome of the procedure. So this is called as what, sir? Informed consent. So express consent orally or in written, either oral or written. Express consent and informed consent, best is combo of both. So informed consent, if we take, first we will inform, then take in written. That is the best thing. The best consent is informed. Informed, then taken in written, my dear friends. Fourth type would be the open, blind or blanket consent. If a one consent is covering all the consent, if one consent is covering all the consent for all the procedure, that is called as blanket. Blanket is covering everything. And this is not valid in India. Why these days this is not valid in India? Because you will see there is a case of organ trafficking. People started stealing organs from the patient's body, my dear friends. That is why this is not valid in India anymore, my dear friends. Now, if we talk about this, not valid in India, consent for multiple procedure taken in a single consent form. In India, separate consent is required for all the procedure. If you have to put RT, separate consent. If you have to put centerline, separate. Follis catheter, separate. If you have to do cholecystectomy, then separate consent is there. So for everything, the separate consent is there, my dear friends. Now, what are the laws related to the consent? What are the laws which are related to the consent? If we talk about this laws related to consent, so before any procedure, consent is mandatory of a patient or a legal guardian. Legal guardian. Legal guardian is a person who is taking care. For example, parents. Best legal guardian is parent, my dear friends. Okay? Minimum age for giving the consent for physical examination is 12 years. But for any kind of major procedure, any surgical procedure, that is 18 years. Physical examination, that means if your age is more than 12 years, you can go directly to the doctor to see the doctors alone. But if there is any kind of surgical procedure, for example, stunting need to be done. You need to put the stunt inside the patient. For that, giving consent age is 18 years and that should be taken from the blood relatives only. Blood relative can only give the consent. That too, legal guardian, if parents are there, if parent is admitted, then child can give. These all are coming under the legalities related to the consent. Now, IPC 92. Consent not needed in a life-threatening condition. Threatening condition like a road traffic accident. If someone is, for example, you are a doctor, if someone is crossing by and there is a road traffic accident, in those scenarios, do you need a consent? No. You do not need consent. The primary aim as a doctor is now to save the life of a patient. Now, the only concern you are having in your head is you have to save the life of a patient, my dear friends. For MTP, consent is taken from mother if she is more than 18 years. If you have to medically terminate the pregnancy, the consent has to be taken from the mother and the mother's age should be more than 18 years. If less than 18, my dear friends, then parents. Parents' consent is required. Husband has no role, my dear friends. Husband has no role. Then in case of artificial insemination, The consent is taken from both husband and wife. If they have to produce child, there is an artificial insemination, my dear friends. You are taking a sperm and then you are injecting inside the uterus of the female. In that scenario, the husband is also equally important. But for the medical termination of pregnancy, husband consent is not required, my dear friends. So in case of artificial insemination, the consent is taken from both husband and wife, because they both should equally know the child is going to come, because they both have to take care of the child. That is why husband consent is mandatory here. In other scenarios like medical termination of pregnancy, the consent is not required, my dear friends. Next line says 351 IPC. Examination of a patient without consent is considered as assault. For example, rape victim is there. Now you have to examine the victim. Now you are not taking consent and you are directly jumping into the vagina. That is not allowed. That is assault, my dear friend. You have to take consent. You have to explain as a medical doctor, as a professional. First you have to explain the scenario, then you will take a consent and then you start the physical examination, my dear friends. Now when the consent is not valid, any consent due to the insanity, intoxication, fear or child less than 12 years. So remember, any consent, insanity, the person's mind is not sound, person was drunk, person was in fear, person's age is less than 12 years, is considered invalid consent under IPC 90, my dear friends. So when the consent is not valid, 4 points here you need to remember. What are the 4 points right here, sir? Insanity, intoxication, fear, child less than 12 years of age. Then it is considered invalid under 90 IPC, my dear friends. Now the next topic what we are going to start is all about the medical negligence, my dear friends. Medical negligence, if talk about what this topic will tell you. Medical negligence, word itself is telling you something is happening between the patient and the doctor. During the treatment, the definition says, during the treatment of the patient, if there is any adverse effect on patient health due to lack of reasonable skill and care by the physician. So something is happening between doctor and patient during the treatment. This is doctor, this is patient, and doctor is treating the patient. Anything is happening here is medical negligence. During the time the patient is attached to the doctor, anything physically happening, that is medical negligence. Now damage suffered by the patient can be, what type of damage that person can suffer with? Pain, lot of pain because of your procedure. The patient is in continuous pain, my dear friends. The patient is continuously like complaining of pain, day pain, night pain. He is not able to do the work. Because of your surgery, the patient becomes disabled. The patient is not able to perform the daily activities. For example, you have cutted the nerve. Because you have cutted the nerve, the patient is not able to move the limbs and he becomes disabled. Third is death because of your medical negligence, because you haven't took better care of your patient, or unskillful, any procedure you don't know and you tried on a patient and because of that procedure that patient died. That also comes under the medical negligence. Prolonged suffering, anything, any procedure you have done and because of that procedure that your patient has suffered for so long, you understand, might be that person is the only earning person in that house, and because of your unskilled procedure, the person suffered the recovery for 1 year, 2 year, 3 years. Who will earn for him? Then these all are coming under these all topics are coming under the medical negligence. What is medical negligence? During treatment of the patient, if there is any adverse effect on patient health due to the lack of reasonable skills and care by the physician, is called as medical negligence. Now 4D elements of medical negligence. We'll be talking now about the 4D elements of the medical negligence. First we talk about the duty. Patient comes to doctor for the treatment of his illness. Then D, coming to the dereliction. Doctor give wrong treatment. Patient comes to doctor for treatment. Doctor is giving the wrong treatment. Dereliction. Damage. Side effect of the drugs. Direct causation. Any major function lost. For example, now patient is not able to use the right hand, left hand, unable to walk. Direct causation. These are the direct 4D element. Repeat along with me. 4D elements of the medical negligence. Duty. Patient comes to doctor for the treatment of his illness. It's a duty of a doctor to treat the patient. Dereliction. Doctor given the wrong treatment to the patient. That is also medical negligence. Damage. Whatever treatment we have provided, because of that treatment, there are certain side effects. Direct causation, any major function which is lost. Now, type of medical negligence is the next topic what we are going to study, my dear friends. So, type of medical negligence, coming to the number one part, is civil negligence. What is civil negligence? Lack of care, skill causing the mild damage. Now, in the civil negligence, the damages are very mild. For example, wrong drug, wrong prescription. Some safe drug we have given, but the drug was wrong. The sign and symptoms were minimum. In that scenario, money for compensation is given. In the civil negligence, punishment is money, and that money for the compensation is given, my dear friends. And who will give the money? Yes, obviously, doctor will give to the patient. Burden of proof lies on the patient. How the patient can prove this? Sir, patient can prove this with the help of prescription. Prescription slip. He has to keep the prescription slip. He has to prove the doctor has written the wrong drug, wrong prescription. This is how you have to prove. Once it is proved, yes, doctor will give money to the patient. Dr. Saab will give money to the patient. Now, second, coming to the criminal negligence. Sir, if we talk about the criminal negligence, there is a willful negligence result in the severe damage. Willful, yes, the mind is sound, you know what is going to happen. Example, forgotten the swab in the body during the surgery, forgotten your mobile phone, and once you have suture, patient went home. Patient is saying mobile in the abdomen is doing. Oh my God! What is this? What my doctor has done to me? So during doing surgery on a wrong patient, for example, two patients are there and doctor is like, oh, I will do this, that. And he has to amputate the leg of patient A. He amputated the leg of patient B. That is doing surgery on a wrong patient. You have to put stent on A, you put it on B. That is a major gross mistake that can eventually result in a death of a person. That is why we call this as criminal negligence, my dear friends. Punishment is there. Punishment is there, that is money. Plus you are punishable under 304A. A we remember like this apron. Who wears the apron? Doctor. So anything happening by doctor which result to the death of a patient during the medical procedure, this is what called as what's a medical negligence punishment. So money plus you will be punished for that under IPC 304A, my dear friends. Burden of proof lies on the doctors. But doctor fails to prove it because all the scenario is favoring your patient. If swab is inside, if phone is inside, if forceps is inside, things or fact, they are speaking for themselves. If left leg needed to be amputated, now you cutted the right leg. Those things or fact, they are itself speaking for themselves that yes, Dr. Saab, you have done this thing wrong. So burden of proof lies on the doctor, but 99% doctor fails to prove because already the things are fact, they are speaking for themselves. This is called as res ipsa loquitur, my dear friends. Now coming to the third negligence, The type 3 negligence, what we are having right here, sir, this is called as contributory negligence. Sir, contributory negligence, the word itself is suggesting the doctor and the patient both are responsible. How the both are responsible? Examples: no follow-up by the patient, treatment not taken properly. Means there is an ex-patient. You forgot to explain that you have to come again and patient didn't come. Then this is your fault. And patient also didn't paid attention to it. Then ex-patient was asked to come again and he didn't came. Then also it is contributory. You didn't call him, you didn't inform other people to call him, you didn't check on your patient. So this is contributory. Now most important thing is what? Sir, in the contributory, the punishment depends on the contribution. So if you have to punish someone, it depends on the contribution. That who is contributing more. If patient's contribution is more, then patient will pay. If not pay, patient will be held responsible. If doctor's contribution is more, then doctor will be held responsible for this. So two important doctrines associated with the contributory negligence. In detail, we are going to study the two important doctrines associated with the contributory negligence. One is last chance clear doctrine and another is avoidable consequences rule. So what is last chance clear doctrine, my dear friends? Let me explain you with the help of example. Last chance clear doctrine. So what is happening in the last chance clear doctrine? For example, there is a case of snake bite. The patient is admitted because of a snake bite and got a very tight ligature on his limb. But the doctor ignored it. And you know snake bite, in the snake bite treatment, you are not allowed to ligate it very tight. It is contraindicated. Immobilization of limb is there, but tight ligature is not at all allowed there, my dear friends. But the doctor Saab ignored it, which lead to development of gangrene. Thus, the doctor is responsible for the damage. Snake bite patient, tight ligature was there, doctor ignored it. Because of that ignorance, there was gangrene. Thus, the doctor is responsible for the patient. Now, avoidable consequence rule. What is avoidable consequence rule? Let's learn this example also, my dear friends. Same example I would love to take for all of you. Sir, there is a snake bite patient admitted. Got very tight ligature on his limb. Doctor advised to remove the ligature. Now, Dr. Saab has told already, please remove it. But the patient did not remove the ligature and result in damage of the patient. Now, the patient is responsible, not the doctor. If doctor will ignore, then doctor will be held responsible. If patient will ignore, then patient will be held responsible more, my dear friends. What are the defense for the medical negligence? A very important things to notice right here. What are the defense for the medical negligence? If you talk about the defense for the medical negligence, doctor not on duty at the time of negligence. For example, patient died in my hospital. Patient died at my hospital and the attendant of the patient now are filing case against all the doctors. So I was not there. I was somewhere else. So I clearly given statement in a court that yes, at that day, that time, I was not there on the duty. The doctor on duty, I was not there. That is why I am not responsible. So doctor not on duty at the time of negligence. That is a defense. Number one, consent taken from patient. For example, I have taken example of RT tube only, Ryle's tube only. While putting Ryle's tube, there was aneurysm which accidentally got injured. Patient died because of hypovolemic shock. We didn't know. But before putting the tube, we have took the consent from the attendant. The patient attendant, we have took the consent because the consent was there with us, we have justified that we were innocent because we didn't know about all the unexpected complication. Third is error of judgment. There can be a misunderstanding. You can prove that with the fact and you will be free from that. Contributory negligence also, like we have studied about the two rules we have studied right here. One is avoidance consequence rule and another is last chance clear doctrine. In both of them, you can prove whether the patient is responsible or whether the doctor is responsible. So for both of them, the rules are different. They can be a defense for all of you. So defense for medical negligence, they are four, my dear friends. Doctor not on duty, first one. Second is consent taken from the patient, error of judgment, and another is contributory negligence, my dear friends. Res indicator and res judicata. Res indicator, case should be filed within 2 years of damage. There should not be like this, any medical negligence happened today and you are filing case after 10 years. Not at all allowed, my dear friends. Case should be filed within 2 years of damage. If damage is happening now, you have to file case within 2 years. This is res indicator. Res judicata. Things that have already been decided in one court cannot be claimed in any other court. For example, medical negligence has happened and the case was filed in the court and the court has already given the judgment. In that scenario, you cannot claim it in the other court, my dear friends. Not at all allowed. The final hearing, the final decision will be of the one court only. That is res judicata. Now, what are the therapeutic misadventures, my dear friends? Next thing is therapeutic misadventure. During the treatment of a patient, in spite of adequate procedures, accidentally patient has suffered a damage. That means we have took utmost care of the patient, utmost care of the procedure. Everything we have took care of, everything, each and everything. But accidentally that thing happened. This is therapeutic misadventure. If intentionally it is happening, then it is what's your misconduct, infamous conduct, negligence, medical negligence. Damage caused to the patient is now unintentional. This is therapeutic misadventure. In therapeutic misadventure, the damage, whatever is happening to the patient, that is totally unintentional, my dear friends. Doctor is not liable for any kind of criminal responsibility because he took care of everything. Now, how you will prove this? We'll check everything. We'll check the report of the patient. Pre-anesthetic checkup was done? Yes. Trained staff was there. Proper instruments were there. Proper steps of surgery were followed, my dear friends. Everything was aligned, but during the surgery, anything happened which was unintentional. Because of that, patient suffered the damages. That in that scenario, a doctor is not liable or responsible for any kind of crime, my dear friends. Now coming to the doctrines in the medical negligence. What are the doctrines there in the medical negligence? First thing, res ispa lequiter. A very famous doctrine is there, res ispa lequiter. Things or fact speaks for themselves. Sir, like in the criminal negligence we have discussed, a doctor has performed a surgery. While doctor was performing a surgery, he left some swab, some forceps inside. So that forceps or swab is itself telling you that they shouldn't be inside the cavity. Now things or the fact, they are speaking for themselves. If things, facts speaking for themselves, this is called as res ispa lequiter. Mobile phone inside is speaking. They should be in a pocket what it is doing inside the abdominal cavity. This is res ispa lequiter, my dear friends. Negligence act is so gross, there is no need of expert witness. In this, expert witness is not required because fact is telling. Also, there was gangrene. Example. Gangrene on left leg. You amputated the right one. Gangrene was there in the left leg and you amputated the right one. That is also a problem, my dear friends. In that also, the things or fact will speak for themselves, my dear friends. Coming to the next, example we have taken, example we have written here also. Retaining the foreign body inside the cavity, cutting wrong organ. Other example also we can take, doing surgery on the wrong patient. Patient number X is telling that, doctor sahab, my right leg need to be amputated, and patient X is telling, doctor sahab, my gallbladder stone is there, need to be removed, and patient Y is telling that, doctor sahab, there is I'm a case of diabetes and my left leg need to be amputated. So factors setting, the gross mistake is there, which are itself setting all the facts. So it is very easy to prove the criminal negligence right here, sir. Now, doctrine of common knowledge. Doctrine of common knowledge, my dear friends. Variant of res is per liquidator. Example, not giving TT injection to the injured person. Injured person came to you. It is very obvious, if an injured person is coming, we give the tetanus injection to the injured person, and we are not giving, my dear friends. That is common knowledge, doctrine of common knowledge, which is again a variant of res is per liquidator. The things or facts are speaking for themselves. Patient came to you in an emergency department, doctor sahab, there is a case of road traffic accident, I got abrasions on my body. And you gave the antibiotic, you gave everything, but you forgot to give the tetanus, and there is no tetanus written in the prescription also. Doctrine of common knowledge. This is again a variant of res is per liquidator. First, let's revise what is res is per liquidator. When the things or fact they are speaking for themselves, for example, retain foreign body, etc. But here, something, a road traffic accident person came to you. When a road traffic accident person came to you, you have given a primary treatment, everything is written on a prescription slip, and you have given everything. But you forgot to write and forgot to give the tetanus toxoid ka injection, which was very, very important, my dear friend. So this type of negligence, this comes under doctrine of common knowledge. That means this is very obvious. It is common sense, common knowledge that you have to give TT to the injured person who is having the abrasion on the body after the road traffic accident, or might be having a self-injury which is inflicted by any iron object. So you have not given, that is coming in doctrine of common knowledge. Third doctrine, doctrine of calculated risk, my dear friends. Every procedure treatment has its own inherent risk which is unavoidable. Every treatment, less, more, that is depending on the type of disease we are having, the level of surgical skills we are having, the level of instrument we are having for the surgery. This is a defense for the doctors. This is again doctrine of calculated risk. Yes, after getting stents in situ inside the person's vessels, coronary vessels, there is not at all a guarantee that the further MI or further blockage will not happen. There might can be, if person is doing heavy work, etc., that can happen. So these are some calculated risks that yes, something can happen. After surgery, there is no 100% guarantee that disease will not happen again, or there will not be a consequences after 6 months, 1 year, 2 years, 3 years. So there is a calculated risk which is explained to the patient, and in the prescription, in the discharge advice only, doctor mentioned this line every time, that danger sign explained. You understand this thing? So this is again a defense for a doctor. Now coming to the next doctrine, that is novus actus intervenius. Sir, the new act is intervening the changes in the consequences. There is a X disease. There is a Y consequences. Now Z is coming in between and the consequences are changing. For example, patient of RTA admitted and died due to septicemia. Now patient of RTA was admitted. Yes, you haven't done the proper dressing. You haven't done proper antibiotic the course. You haven't given patient the antibiotic course properly. You haven't followed up the patient. You haven't done the clean wound suturing. You haven't done the aseptic dressing properly. Because of that, your patient died after 4 to 5 days. So this is something called as novus actus intervenius, a new act intervening. Already the patient was suffering from RTA. The patient was having multiple fractures. multiple fractures. The patient were having multiple fractures, and then after multiple fractures you have treated fracture very well, etc., but you haven't took care of the infection. Because of that the person died because of the septicemia. So new act is infection. The negligence was for the infection right here. Now coming to the fifth doctrine, my dear friends, that is vicarious liability, also known as respondent superior or the let the master answer. The word itself is telling you something. Superior is responsible for the act of junior. For example, you are intern doctor. I ask you to put the IV cannula. Now you punctured the artery, vein, and the swelling happened, this, that. Now whom will be responsible? Whom will give the answer? Senior doctor, maybe JR, maybe SR, maybe consultant. And if anything JR, SR, consultant is doing, if anything is happening, is happened from them, then who will answer? The owner of hospital. And if there is a government hospital, then medical superintendent will answer, my dear friends. This is how the chain will work. Junior, for the act of juniors, who will answer? Senior will answer. Who is responsible? Responsibility junior doctor has to take, but answerable is senior doctor, my dear friends. Now the sixth thing we need to learn right here, that is loco parentis. Loco parentis means in the place of the parents. Loco parentis means in the place of parents. If the parents are not there, the consent can be obtained from the person in charge. If something like surgery need to be performed and we need consent, and person is living alone in the X city, now for that person the local guardian can give the consent. And if local guardian are also not available, then who can give the consent, my dear friends? Then police. Police can give the consent. There will be a case, there will be MLC done, police is called, police will be giving the consent for that. So this is all the loco parentis you need to know. If he is not available, then whom, then he is not available, then next whom. Okay, chal. Now coming to the very next topic called as euthanasia. A very important topic, my dear friends. Euthanasia, we'll be learning very beautifully this, also known as mercy killing. What is euthanasia? Euthanasia is also known as mercy killing, my dear friends. Now, painless death is given to a person suffering from an incurable disease. Painless death is given to a person. Incurable disease. For example, person is in end stage of renal failure, heart failure, incurable. We cannot cure, and HIV end stage. Everything worst has happened. Now only death is going to happen. Only we can delay the death where we cannot stop. But patient is suffering a lot. Pain is a lot, not able to eat, everything is gone. Then in those scenarios, we can give the mercy killing. And voluntary euthanasia is not valid in India. Voluntarily, you cannot. Only the government, or you can say the medical health authorities, will differentiate. And now we'll learn about the different type of, okay? Voluntary, or you can say correct word for voluntary is active. Active euthanasia is not. Active euthanasia, I'll tell you the difference between active and the passive euthanasia. So what is the basic difference between the active and the passive euthanasia, my dear friends? We'll be talking about that. Active euthanasia, inducing death in a person with the help of drugs. This is active. Person is in the hospitalized and you are just injecting the drug to make the person die. But passive euthanasia, inducing death in a person by removing the life support like the ventilator. The person was already like in a coma. He was on ventilator and I just removed the ventilator, passively he died. But person was fine, person was hospitalized and person wanted that I want to die. We have given injection, drugs like phenobarbital is most commonly used, my dear friends. thiopenton sodium, potassium compounds. These are the drugs we can use for the active euthanasia. Phenobarbital, thiopenton sodium, potassium compound, directly their effect is on the heart. Heart will stop working. When the heart will stop working, eventually the person will die. So this is active euthanasia. Active euthanasia with the help of drug. Passive, we just remove the life support like the ventilator. Now in the passive euthanasia, need permission from the Supreme Court to conduct it, my dear friends. So active is not valid in India, but passive is yes valid, but we need permission from the Supreme Court. So you understand the importance and the severity right here, sir. Active, which is completely banned in India, not valid in India, but passive one, you need to go till the Supreme Court, my dear friends. Now, next thing is, we just like classified into three categories. Like euthanasia, we categorize into three categories. What are those? First we have to write, I will love to write it's voluntary. Means patient wants to die. Patient said, I don't want to live, I don't have money, etc. Whatever reason he is giving, patient want to die. Second is involuntary. In involuntary, guys, remember, involuntary, against patient will, against patient will. Patient don't want to die, still he is forced to die. Third thing is non-voluntary. Non-voluntary, if I talk about comatose condition. Comatose condition, person is not able to tell you whether he want to live or not. But if someone is in coma, there is no chances of him getting up again back. You can go to Supreme Court, you can get the permission and you can go for the passive euthanasia in that. Done? So these are the three types of euthanasia: voluntary, involuntary and the non-voluntary, my dear friends. Now the next topic what we are going to study right here, sir, is the medical records. Sir, everything whatever happening in the hospital need to put in the record, my dear friends. So if we talk the medical record, indoor patient record must be maintained for 3 years. IPD, inpatient, short is IPD, means patient got admitted in the hospital. The patient who is admitted in the hospital, his or her record must be kept for 3 years, my dear friends. Outdoor cases or routine cases, record must be maintained for 6 years. OPD cases, the outdoor cases, record need to be maintained for 6 years, my dear friends. Medico-legal documents should be maintained for 10 years. MLC cases, medico-legal documents, evidences, etc. need to be preserved for 10 years, my dear friends. In case of patient's death, record must be maintained for 3 years. If person dies, my dear friends, record must be maintained for 3 years. Now, if patient requests for copy of medical records, the copy must be supplied within 72 hours, or in short, I just say 3 days. So medical record is something, the record, there is a MRD department in a hospital, MRD department, medical record department, particular department is there, where all the IPD record, inpatient record, OPD record, all the investigation, whatever happening in the hospital, all the death records, everything is there. Just the time limit is there. If I talk about the IPD, 3 years. OPD, 6 years, my dear friends. And medical legal document is there, sir, 10 years is there. And if anyone needs a copy of a medical records, any record, Doctor, 1 year ago I got admitted in your hospital, I need record now. So you just write the application on the name of superintendent. That application will be diaried over there and you will get record within 72 hours. If they fail to produce record within 72 hours, they have to give answer and you can file case against them. That is your constitutional right, my dear friends. Done. Now we are done with the chapter number 3, my dear friends. Thank you so much.